So my space is typically we have a private Facebook group that is for women who are going through medical intervention, specifically third party reproduction. But I do open the interviews because I know a lot of women who don't know how to even get started. So I open up the space for women who are going through medical intervention. And I like your story because it's a very special case because you didn't have problems getting pregnant. It was staying pregnant that was really the issue. And so a lot of women think because they can get pregnant, like they don't need to take any step further. They just keep waiting and waiting. And so I want to welcome for the conversation tonight, Krystal, and we can start wherever you want to because I know you said in your story that you got married and you, honey, said, "Let's do it. Let's get listen. We need to start tomorrow, but let's ride, rewrite at dawn."
It was mainly my husband. The minute we got engaged, he's like, "I'm gonna get you pregnant. You're gonna have a baby bump, and we're gonna do a baby shower and a wedding." So I was terrified the whole time we were engaged that I would get pregnant. So I actually was off birth control and got on it during the time we got engaged. And so after we got married, he's like, "You are my wife. You know, we're doing this." And honestly, just like you said, the only thing we ever really hear about growing up is don't bring home babies or how it's difficult for some people to bring home babies. And so the first time I got pregnant, and especially because it came out of nowhere, literally, I thought like, oh, okay, I'm pregnant, everything's good, and that was not the case. And I think just looking at the promo video, I'm like, oh, you summed this up very well. So yes, I got married um, October 2022. Christmas Day 2022, my husband and I said, you know what, let's really try for baby. And I was pregnant by January.
Oh
So
wow. Oh wow. Yeah. So seems like you didn't have any issues with your cycle or anything like that. Like you it was just right on okay, and there we go.
no, I was very shocked, especially because for years, even before I got married, I was told that I had PCOS. So right when I got engaged, I actually did an official workup, and it turns out I didn't have PCOS. So I'm like, oh, there's really nothing wrong with me. I'll be good to go to have a baby. And so I got pregnant, and I found out I was pregnant in February of 2023. I got my OB confirmation. We told parents. My mom was actually watching live. So we told our families that we were pregnant, and then unfortunately I knew something was wrong even from the beginning. I had a lot of bleed. It was spotting mainly. It wasn't painful. It was just a lot of spotting, and my pregnancy never progressed the way that it should have. And so they were under the impression that it was an ectopic pregnancy. And so they treat that with a drug called methotrexate. And I'm a healthcare worker too, by the way.
Okay, okay.
Yeah, so I'm a healthcare worker, which makes my story 20 times sadder because at the time I was working with young adults who had colorectal cancer, and so a lot of my job was doing fertility preservation for patients. So the
Okay.
fertility clinic that I actually ended up going through was the clinic that I sent all of my patients to. So I was very familiar with the providers, and they knew I worked there. The cancer center and the fertility center are literally next door to each other.
Right.
So, um, after my first pregnancy wasn't progressing for about 6 weeks, I did the methotrexate, and I didn't know that it was possible for a person to cry so much because I'm like, I did it. I got pregnant. That was literally
Right.
the hard part, and it just wasn't easy to be sustained. And so, after you take methotrexate, they actually recommend you wait 3 months before you get pregnant again. So 3 months had passed, and honestly, like I was feeling better about myself. I had a lot of shame, a lot of guilt about having a miscarriage, and especially the embarrassment of knowing like we just told our families and then it happened. So
So
around
let
three,
me ask you this before you proceed. So why did you feel embarrassed?
it's very hard to be excited and tell people that you're pregnant,
Mm-hmm.
and then you have to go back and say you're not. And honestly, like I have very good friends, very active social life, very active social circle. And I remember like during that time, some girlfriends and we went to a winery, and I had to tell them like, hey, I can't drink because I'm pregnant. And then the next time we went out, it's like, oh, I can drink again. So
Right. That's understandable. That's definitely understandable. I think that a lot of women know that situation all too well. That you get to the point, because how far along were you?
I was around 7 weeks.
You were out 7 weeks? Okay, so a lot of women go through that, and they have to go back and say, "I'm not pregnant anymore," or they'll go, "How's the baby doing?" or "How's the pregnancy going?" You going, "It's not." So
And
yeah,
yeah, that was probably the most heartbreaking part of it. And so, took the methotrexate. My husband and I, were just trying to get back into like our routine of life. And the 3 months had passed, and he asked me, he's like, "Do you want to try again?" And I said, "You know what? Mentally, I don't think I can go through that again."
yeah,
And so we went to my niece's high school graduation, had a great weekend. I was supposed to get my period. My period never came. I was taking a test like every other day, and I'm like, okay, I don't think I'm pregnant. And then finally I got a positive, and I'm like, oh, I am pregnant.
right.
And initially with that pregnancy, from the beginning, the providers were like, we don't think this pregnancy would be viable.
So why did they think that?
So with my first pregnancy, they thought it was ectopic, and I was heavier. I was about 80 pounds heavier.
Okay,
And I just, even with the whole PCOS diagnosis, I felt like they were just giving me reasons why they didn't think that it was successful.
yeah,
Like I was pre-diabetic. They're like, oh, well, you could have insulin resistance, and that's why the embryo got stuck in the fallopian tube. And so, just based off what my HCG was with my second pregnancy, we're like, we don't think this one will be viable. And it wasn't even necessarily the news, it's just the fact that, my physician sent me a my chart message to tell me that.
yuck,
Yeah, I don't even the trauma of with my first pregnancy of them telling me that my pregnancy wasn't viable. I literally had a physician. I'm a nurse. I work in healthcare. I work next door. I walk over. It's no secret that I work at the same building.
right.
Um, I had a physician mansplain to me what pregnancy was, and that I was going to the doctor every other day, getting ultrasounds, getting labs drawn, and he said, "You know what? You're young. You got pregnant fairly easy. You should terminate this pregnancy and just move on with your life." Left me in a room hysterically crying by myself. And then even making the appointment to get the methotrexate, I had to stand in a line full of pregnant women to make an appointment to terminate a pregnancy. And I'm like sobbing in this long line. And I didn't want to go back to work. No one asked me for a work note, but I'm like, can I just get a note for work? And they wouldn't write me one. It was very traumatic. And I work here. So I can
Right.
imagine how you treat people who don't work here. And even after getting the methotrexate, they do draw labs to make sure the pregnancy has passed. And I remember sitting in the chair waiting to get my labs drawn because I'm a difficult stick. I'm getting stuck 5 or 6 times. And, the medical assistants, they're talking about going to labor and delivery because it's going to be happier. And I'm like, you do realize not everyone brings home a baby, right?
Right.
Which is the other trauma to it.
Yeah.
So with my second pregnancy, just from the beginning, they did not think that it would be viable, and I wanted a second opinion. I'm like, you know what? I don't take this. Like this pregnancy feels different. I feel like it can progress normally. I'm going on Google, like who can help me, and so I seen that there's maternal fetal medicine, and I'm like, oh, I want to see them. They would not make me a referral until I agreed to do methotrexate again. And I literally said that it's documented in my medical record that I feel like I'm being forced to do something that I don't want to do, that I think is unnecessary because you're withholding a referral. And I didn't know at the time that maternal fetal medicine cannot see you until you're at least 11 weeks pregnant, which makes sense, but there's someone they could have sent me to in the interim. So I took the methotrexate, and then I had an appointment with maternal fetal medicine, and I had a 2 hour doctor's appointment. And probably for like the first hour, I just sobbed to tell them how horribly I had been treated and just not listened to or respected. And so she didn't believe either of my pregnancies were ectopic.
Yeah.
And just where I worked at the time, one of the good benefits is they have fertility benefits. The only thing is you have to be employed there for a year. And so I started when I came back from a honeymoon. So I started in October, and this is now the following um, July. And so the first thing we did was we did an HSG study to check my fallopian tubes to see if they were patent, and they were patent. And I just had to wait the 3 months after the methotrexate, and we're like, okay, we'll try again.
And I'm not a medical professional, but I'm usually, and we've had women on here who've had ectopic pregnancies, and the first thing that they do is, remove tubes. Like it's a situation where they get their tubes removed, and it sounds like that didn't happen to you. You know,
My pregnancies were far enough that they're not considered chemical, but they were small enough that they weren't able to be detected. So
got
I'm
you.
fortunate in the sense that I didn't lose any fallopian tubes and
Right.
that I was able to be medically treated because we caught them early. But also, when I talk about my IVF journey, I learned that none of my pregnancies were ectopic.
Right. That's what I said because even we've had women they haven't progressed that long, like immediately, if you're talking about a situation with two possible type, they're gonna just remove those tubes altogether. They're not gonna just sit there and just let you keep getting pregnant. They'll even recommend saying the best thing maybe you need to do is so that you can have a successful pregnancy is to
They
remove your tubes.
They didn't
Right.
tell me that. They were
Right.
literally
Right.
like by the
Right.
second, the first miscarriage, it's like, oh my God, I'm so sorry. Please call the office if you need anything. The second
Right.
miscarriage, it was, oh, we're sorry this keeps happening to you. Call us if you need anything. And in my mind, I'm like, is no one concerned but me why I keep getting pregnant and I'm not
Right.
able to sustain these pregnancies? No one has any like inkling or anything. And even just removing tubes, we don't know which fallopian tube was blocked, which is
Right.
why the HSG was ordered. And it turns out neither one of my fallopian tubes were blocked.
Yeah, that's what I say. It all just it sounds like either they definitely sounds like medical, I'm sorry, but medical neglect because even still like if you are so well now being an IVF patient that you can see an MFN as long as you've been referred. Like they're not going to really see you unless you've been referred, but you can see them still as early as, you know, we've had women who've seen them as soon as they detect pregnancy and they are on watch because they've had multiple miscarriages and losses and stuff.
So
So,
the North Carolina is a little bit funny. And so
mhm,
the way that North Carolina works is I wasn't able to see MFM until I was at least 13 weeks.
right,
So I had to be managed by an OB until I reached 13 weeks. But my maternal fetal medicine physician, I cannot thank her enough.
right,
She sent like the nastiest letter. She's reported physicians to the board because of how I was treated and just the whole situation. And even like, I'm gonna emphasize like I work here like I'm
right, right.
like
You keep saying, I work here. You have to see my face again.
the physician that sent me the my chart message, especially because at the time I was working with cancer patients. So, I'm used to telling people bad news, and there's a way that you do it.
Right,
And like we had the conversation because in appointments he would talk to me about his wife, and I'm like, well, I'm his wife. Like this is my
right,
I'm his wife. I'm someone's loved one too. And I asked
right,
him when he sent me that message, my immediate response is, do you think that was the most appropriate way to deliver this news to me? And then
right,
after that, I see him at Chick-fil-A and in the hallway every day because we work in buildings that are next door to each other. Like we're
right,
standing in line at Starbucks together. Like I'm not when I say like I work here, I'm referring patients to you.
right, right,
Right?
right. I apologize. It's like when you hear stories like that, you go like, "What is people thinking?" Sometimes, like it just makes no sense of why you would do that. And I always say, there's just some people that medical professions, you either have a passion for it or, and, some people it's just a job. And you can always tell those people where they're in it for it's just a job. And you can just tell some people who are just passionate about it because, no true position that you is consider a colleague should have treated you that way. And I'm so sorry for that.
I, I'm working through it. I no longer see that practice anymore, but
As you said.
maternal fetal medicine, they did a workup on me. We did genetic testing because I thought I was a sickle cell carrier for some reason. My husband is a sickle cell carrier. So we did some genetic testing. She also ran an immunity panel on me, and she just ran a bunch of testing just to see what the cause was for this. And it turns out I have something called antiphospholipid syndrome. It is a rare autoimmune disorder. And one of the things that it's characterized by is multiple miscarriages. So
Gotcha.
so she found out I have it. You have to test positive for it 16 weeks apart. So I tested positive for it twice. And just the reassurance with my HSG being clear and knowing I have antiphospholipid syndrome, it's just the minute I find out I'm pregnant, I have to start aspirin and Lovenox. So, we did this, celebrated the holidays, and then starting 2024, we're like, okay, we're going to be back on the baby train. And I said, if we're not pregnant by July, and my husband and my birthday are actually 5 days apart, I'm like, if we're not pregnant by July, we're going to at least do IUI. I didn't even want to do IVF.
Yes.
Like, we'll do IUI. And just speaking with maternal fetal medicine, they're like, hey, the insurance covers it. Like, I'm a reproductive doctor. So, of course, I'll recommend IVF and knowing that your insurance will cover it. So, we'll always recommend that. And, we're sure you'll have success. But I'm like, no, if I can do it on my own, I'll do it on my own.
Right.
So, March of 2024, I found out I was pregnant, and immediately we knew that that pregnancy was not going to be able to be sustained. So when I met with the reproductive endocrinologist who I've worked with for many years, like I went in her office, cried, she hugged me, and I said, I just want to do IVF. And she's like, given your history and given everything that you've been through, I think that's pretty reasonable. And I told her, I'm like, we were actually about to go on a trip. And it felt like every time my husband and I were going on a trip, I had either just had a miscarriage or was going through a miscarriage. So,
Wow.
first pregnancy, took methotrexate on Wednesday, went to San Francisco on Friday. Second miscarriage, took methotrexate, went to Jamaica a week later. Third pregnancy, I was going to Houston that weekend. So it's like, I don't even want to travel anymore because I feel like I'm ruining all of our trips. And we actually had a trip to Panama planned in May. And I'm like, please don't, like, let's plan this after we go out of town, have one decent vacation. And so that's what we agreed to. And plus, getting methotrexate for the third time. I had a very bad reaction the second time I had methotrexate. Methotrexate is actually a form of chemotherapy. So it is a very, very, very harsh drug. And I took it and I was heavier, so I took it back to back. I lost about 50 pounds during this time, and part of it was from depression.
So what did they think the third time was? It was from the syndrome that you had then. So we pinpointed that it's the syndrome, or nope, nope, nope.
No,
Well, you know what? You know what? I'm predicting your own story. Let me let you finish.
no. Doing during my IVF workup, when you get to the point when you're doing your trial transfer and your saline test, so they found out I actually had a polyp in the middle of my uterus. So I had a golf ball sized polyp, and that's where all my embryos were attaching. And so we removed that. And honestly, by that point, I told my husband, I'm like, well, do you even want to go through IVF? Like, if this has been the reason this whole time. And he's like, honestly, we paid for the drugs. Let's just go ahead and see it
Mhm.
through. So it was a polyp. They thought it was a fibroid. It was not. It was a polyp. They took it out. It was non-cancerous. And just where it was sitting at, it was patent enough. It wasn't blocking my fallopian tubes, so my fallopian tubes were still patent, but it was close enough to my fallopian tubes that they realized that all my previous pregnancies were attaching to that polyp.
Okay. Okay. So knowing this information, how did you feel about now? Because it seems like you were kind of hesitant about doing IVF anyway, but just how was it knowing those answers going into now your IVF cycle?
Honestly, I couldn't handle one more thing being wrong with me.
Right.
And even the decision to do IVF for us, it was we skipped over IUI. I'm like, okay, obviously we don't need IUI. Let's just go to IVF. And we had discussions because even doing IVF, there was not a guarantee that I'd be able to sustain a pregnancy.
Right.
Um, just I don't know if you've interviewed other moms that have antiphospholipid syndrome.
So this is the thing when so so probably, and I'll have to do probably Lovenox. I've never done Lovenox or anything like that, but most of the time your protocol, sometimes they'll automatically just put you on it. So it's not necessarily knowing that they were diagnosed. It's just that if you've gone through a situation where you've had multiple miscarriages, usually we're going to do something a little bit more stronger to help with your protocol. So all my protocols before have just been like progesterone, estrogen. But this time he's like, at this point, we need to do what's called like a kitchen sink protocol, which means that you do, even though I don't have a blood thinner issue, that something is happening as you is, I'm getting, even though I didn't do natural pregnancy, he's got me pregnant 3 of the 4 times. So I've gotten pregnant and I've done the same thing about 7 weeks, like 5 to 7 weeks or whatever. It just stops. So on paper, it doesn't look like I have a blood thinner issue. However, something is happening that I may need something to either like an autoimmune, that my body's like, what is this? And we don't want it. And I have to, tell my body that, we kind of want this, and do the same protocol. So we may not all get diagnosed with it. They just stick us on it. I think Lovenox is a pretty easy, not an easy, but just something that they just throw on you anyway.
And you know what's crazy? Like antiphospholipid syndrome is allegedly so rare. You actually have to have 3 consecutive miscarriages to even get the testing done. And
Right,
maternal fetal medicine, just based off lab work and what our discussion, she's like, I think I should test you for it. And
right.
I've met so many people who've had it that it's like, is it really that it's rare, or is it just that we keep letting women miscarry and do
You just
nothing?
keep letting, yep. Yes. I think that's what the thing is. I think they do what your doctor said to you is you're young. Cause how old are you?
I'm 32.
You're young. Definitely you're young and you can get pregnant again. So in their mind is we don't need to do all this extensive testing when we know you can get pregnant. It's just that one time, the next time you'll just stay pregnant. But when is that next time going to be?
Honestly, I told her too, just the fact that I had a miscarriage in March and I had a miscarriage in July. I had two
Right.
miscarriages back to
Back to
back.
back. Right.
And there was, I mean, again, I work for this hospital system. They provide therapy for you for up to a year. So this was me reaching out to HR for my benefits to have therapy done. But no
Right.
support services were offered, no grief counseling, no
Right.
resources, no support group, no nothing. It was just, oh, you miscarried. I'm so sorry. I had a miscarriage too. Call us if you need anything.
Right. Yeah. I mean, I wish I could say that every story that I've shared, because we're on 27 interviews at this point, but probably 20 of the majority of the interviews are all similar to say that either, you know, you've got one person who's been in your corner, which it sounds like your MFN, but a lot of us had to fight. We had Ursula on here who basically she had fibroids, and they said we can't. They're too large. You just need to get a hysterectomy. So it's it's definitely problematic. And I don't know if it's an issue of it's just all women or just certain women of a certain race that get these answers of we just need to just take your uterus, or you just need to be on birth control, or get over it, and just keep trying. That there's not that um we have to fight for answers, and that's not what you should be able to do when you're going to when you're going to help build your family. It shouldn't be like, well, just keep trying. You would hope that someone would help you, and a lot of us don't get that. I tell everybody I'm on my 10th clinic. My doctor is retired at his clinic and he's going to Nevada. So guess where Ronnie's going to? Ronnie's going to Nevada to go follow him because I know that he is invested in me. And so I don't even want to start over. Um, when I got pregnant, and then, like, because I was like one of his last patients, and you want that doctor to be like, I've gotten you pregnant 3 times. Like, what is going on? And we both just he's just sitting there. He's like, I just, he feels just as defeated because this is his passion. And so when you see that, you wonder like why other doctors do that same kind of thing. And that's what I said. I just think it's a situation of it's not really a passion, it's just a job. And if you're not the right person or the right color, they don't care.
What's sad is with my, because I'm also on my third OB practice. I I had been a patient at my first OB office for probably like 6 or 7 years. I seen a black OBGYN, and the only time she ever checked in is when because my practice is closer to my house, and just with the high risk and everything going on, they moved me to where my job is, which is a level 1 trauma center. And so when I was unhappy with the way they were treating me, I sent her a message saying, I don't like the physicians at this office. Can I see maternal fetal medicine? And that was the first time she responded. She's like, oh, I'm actually out of town. However, I really think that if this pregnancy is truly ectopic, you're putting yourself at risk by trying to delay it, and you should move forward. But I seen 7 different physicians in the 7 weeks that I was pregnant with my first pregnancy. So I seen pretty much every provider in that office, and I'm like, nope, I'm good. 7 different
I
people.
Again, I'm on my tooth clinic, so I don't.
And
You know what
even
I'm saying? I'm like, listen, do what you need to do is how I am. Like, do what you need to do
my second
because
my second provider, my second clinic, I seen another black OBGYN, and it was after my HSG. I'm excited. I'm like, I want a new OB, because I know I'm going to get pregnant quick. And firstly, that appointment started with me and the medical assistant going back and forth, because she kept saying, she's like, well, it says you have an active pregnancy. It says you're 27 weeks pregnant. And I'm like, I'm clearly not pregnant. She's like,
right.
active pregnancy. I'm like, I don't know why they didn't end my second pregnancy. I'm not like, I told this woman 5 times that I was not pregnant, and I clearly did not look pregnant. And so
Especially 27 weeks, girl. There should be a bump. 27 weeks, we should see something, okay?
and this lady comes in, and she's like, oh, you're Krystal. She's like, you've got morbid obesity, hyperlipidemia, reoccurring pregnancy loss. Does that sound right? And I'm like, well, dang, when you put it like that, I sound terrible. Like, I don't, when you read me for filth, like, and so I'm like, is it me? Like, am I sensitive, or like, what is it? And my reproductive endocrinologist actually recommended the practice that I see now. And even like my first appointment with them, I was like, look, I have gone through it. And I'm like, I am a doctorate student. I'll be done in December with my doctorate. I'm 32, but I have been a nurse for 13 years. So I'm educated. I've got the money. I work here, and I'm like, y'all aren't listening to me because I'm black. Like, that's what it
Just
is.
call it what it is. Call it what it is.
Let's call it what it is. And even a few weeks ago, I had an incident where my baby was facing my placenta, so I didn't feel the move for a little bit. And so I called the OB, I called the emergency number. No one answered. I sent them a my chart message saying, hey, I'm on my way to work. I'm going to stop by the office as soon as I, get to work. And finally, the triage nurse called me back, and I'm like, no, honey, we're not going to do this. I'm already here. You can just
Right.
tell them, you can tell them I'm at the door. And one of the nurses came up front, and she's like, you can't just walk in here without an appointment. Y'all are going to see me today.
Right.
I don't,
Surprise.
like, I, and then later on, when I got lunch, I seen her. I was like, oh, I seen you this morning, and you told me I couldn't come in without an appointment. Guess who got seen?
Right.
Like,
What are we doing here?
I'm so confused. But yes, it was doing IVF was very emotional for me. And it was mainly because I knew that if IVF were unsuccessful for us, we were doing one round only. And honestly, we would have taken having children off the table for us.
Wow.
Like I think with my third miscarriage, especially because I didn't do the methotrexate, I actually took the abortion pill, which did not work. Um, I did methotrexate, which did not work. I was actually starting to get septic from that pregnancy. And it's
Mm.
like my body, I'm not able to carry this baby. I know I can't carry this baby. This baby does not want to leave me. And I'm like, I cannot continue to put myself through this. And so I'm like, if IVF does not work for me, then will it be okay if it's just the two of us?
Right.
And that
And what did you do to make yourself be okay with that before going to your transfer date?
I don't think I was ever okay with it. Um, I think that going through multiple pregnancy losses is it's a very cruel thing. And I mean, you've been where I've been.
Yeah.
So I know for me, like mentally, I could not handle it. I lost 50 pounds in like 6 months. I was very much isolating myself from family, from friends, even my husband. Like I just wanted to the fact that I got up every day and took a shower was like I can't believe like I made it through today. Like I got up. And I don't think like going through losses like that, especially in such a short amount of time, is healthy for anybody.
Yeah.
And even doing IVF, like I see hematology for my clotting disorder. He's like, there's no guarantee IVF will work for you. And I'm like, I'm well aware.
Right.
I'm very well aware. So I had a lot of anxiety. And even like during the IVF process, like I remember my doctor she delayed my egg retrieval. She's like, you've got so many tiny follicles. I just want to give them a day or two to plump up. And when you do IVF, you feel full, you feel bloated. I woke up one day and I felt nothing. I'm like, I ovulated. I went through all of this for nothing. Like I'm spiraling. Like I'm crying. I don't want to go to this appointment. And then I went to the appointment and everything was good. And I'm like, I've not been able to get good news. I've not
Right.
been
Yeah.
able to have anything go right for me. So I've literally, even like being pregnant, like I have literally held my breath every single day.
Right.
And I know my mom's on this live. She always says there's nothing wrong with this big headed baby.
But what you said is, and so my last loss was in November. And I think you perfectly explained that very well because a lot of people, as soon as like it's over, it's like, well, when are you gonna go back? And I'm like, they may not see me for 6 months, baby. Like I don't know, because it's and there are some women who can do that and go back to back, but I can't. Like I mentally, I was like, yeah, I'm gonna go in January. Then January was coming. I was like, oh, I'm not going back in January. And even like I still have a message from my nurse saying, hey, we need you to go back and so we can make sure your ACG numbers are zero. Have I gone back? No. Mm-mm. I know they zero. So listen, do I have to? But I still have to do it before I start? That's fine. I'll do it, but I'm not gonna do it right now because because I say this. I said there's nothing worse than waiting on those two pink lines and then they tell you to take another test to watch those lines go away, and you can get somebody else to do it. You can get somebody else to do it because it ain't gonna be me. You can't pay me to take a test right now. You know.
I'm it's and I think that's the thing that people don't realize is like how triggering it is. And like I was able to I got pregnant 3 times back to back to back. I did not try that hard. And
Right.
honestly, like being intimate with my husband, like some days I'd be like, please don't put another baby in me I can't have.
Right.
Like the thought of taking a pregnancy test like gives me anxiety because I'm like, it's gonna come back positive, but am I gonna have a baby at the end of this?
Baby. Right. Right. And
And
that's just true. It's like every positive pregnancy test does not lead to a baby, and that's unfortunate to say.
being young and people. I watched a girl take a pregnancy. She's like, "Oh, take a test with me 6 months postpartum. This is my pregnancy announcement." I would never do that. I didn't had too
Right.
many losses. I in the promo video, you had like four different versions of positive pregnancy tests for me. I'm like, because this is
Right.
this is yeah, it was very easy to get pregnant, but no one told me how hard it would be to sustain a pregnancy.
Right. And I don't think that we talk about that. That's why I wanted to open up that space for women who, especially you being young, because, everybody thinks that this affects people who are like over 35. And I'm like, no, we have some 20-year-olds in our group. We have women who are young and they have infertility issues. And so opening this space up to women who get pregnant, and don't have any problems in staying pregnant, there needs to be a space for all those type of women who are now, like you said, embarrassed because I'm getting pregnant and now I still need medical intervention to stay pregnant, can affect your mental health because you're saying it was fairly easy for me to get pregnant. And so when you do that, you're going, it's the blame game of what did I do wrong? What did I do wrong? And it's nothing that you did wrong. It's just that this is just your path that you just need to do to bring home your baby.
I remember my first pregnancy. I shared an office space, and my office mate was pregnant. We got pregnant around the same time. She was able to carry her baby to term, and I went to her baby shower. It didn't bother me. In my promo video, my 14-year-old niece got pregnant and had a baby. That didn't bother me at all. But I remember driving home one day, and there was a woman on the street, and she had a sign that said, "Homeless on meth, please help." That's what got me. And I'm like, I was on bed rest. I'm going to the doctor every other day. I'm missing work. I didn't give it my Publix turkey sandwiches. Like, I've done everything I could do and nothing worked for me. And that's why with this pregnancy, I've just embraced it. I'm like, there's nothing I can change. There's nothing I can do that's going to make this pregnancy outcome different for me. So I
Right.
haven't. I lost a lot of weight. I still go to the gym when I can. I'm still eating my Publix turkey sandwiches. And that's my business.
Talk to me nicely, okay? We listen here, and we do not judge.
So I'm gonna eat. And honestly, like, I ordered a sandwich at work, and someone's like, "Don't you need that heated?" I'm like, "Someone's doing meth. Someone's doing meth right now."
Let me have my little was it the processed meat because you
Yeah,
can't have, yeah, just let me live.
yeah, we
um
are.
so your IVF process, I just want to walk through that. How many eggs and everything? What was your first? Do you remember all of it?
Oh
Well, you probably
yes,
remember because it was just, yeah, it wasn't that too
yeah.
long ago.
I just did it. I had a
Yeah,
very
right.
I had a very short IVF cycle, just because I was able to get pregnant naturally. I did. I'm trying to think the drugs I did. I know I did Menopur and, oh God, Follistim. So I did
Yeah, follow stem. You either do Gano or follow stem, Menopur,
Ranorelix.
Ganirelix. Yeah.
So I did 3 weeks of birth control to, suppress my natural
Okay.
cycle.
Right.
And then I did 12 days of hormones. And then I had 14 follicles removed on my husband's birthday. 11 of them were mature. 9 of them got fertilized. And so I ended up with a total of 7. So
Oh, that's
I
good. That's good. That's really good.
so I have a 5 AA embryo in me.
Nice, nice, nice. And so I will kind of explain for those who don't know. So age is on her side. So 14. Um, and I'm assuming that they just did probably not an aggressive cycle for you because you said it was 12 days. So because honestly, it feels like you probably could have got a little bit more, but it sounds like they just kind of just did a base. And then two, everybody doesn't respond. That's what I tell people when people say they can get pregnant. Um, naturally all the time. Medical intervention is a little bit different. So you may not respond to the meds. They may have to be more aggressive with the medication in order for your body to respond. Because now we're trying to get more than one egg to grow. We're trying to get multiple eggs to grow. So sometimes what will happen is your first cycle may not be that well, and so the second one your body kind of catches on. But for you to get 14, that's basically 50% of what you retrieved. You got good embryo. So you know a lot of people think like you're supposed to get 20 or 30 or 60 eggs, and that's not always the case. For her age, I feel like that's a decent amount, because again, I don't know her exact protocol, but it seems like they were a little bit conservative for you.
They were, and then I had a mild case of ovarian hyperstimulation.
Right.
So I was a little disappointed. I thought I would have higher numbers as well too. But
There
I mean,
y'all go.
all you need is one. All you need is one.
All
So all you need is one. So I got my one. And so I have six frozen, and it was very important to me that I wanted to do a fresh transfer.
okay, and why was that?
Just with the numbers that I had and my anxiety, I'm like, I want to do it. I want to get it out the way. So we didn't do any embryo testing. We didn't know what any of our embryos' genders were. And we just opted not to do that just because my husband and I had already did genetic testing, and he is confirmed to be a sickle cell carrier, and I'm a carrier for albinism, even though I have no albino people in my family.
Right. And and they'll probably say that's okay, because of your age. They will probably, it's perfectly okay, because again, you're, especially if you lost weight, you're healthier. um you've done the genetic testing, they may not recommend it. What I just tell people is, if you can afford it, go for it. But if you can't, then we have IVF babies who have not been tested. All my embryos have been tested, and I still don't have a take home baby. So that doesn't, also, as you said, doesn't guarantee you bring home a baby because they're genetically tested or not either. So again, when you're doing genetic testing, that's just extra money. If your insurance doesn't pay for it, it can be up to 2, 3, 4, 5K, depending on the clinic, extra on top of your IVF cycle.
And even though I have all of these numbers and all these embryos, there was still no guarantee that I would take home a baby. Just
No,
with
it's never. No, it's just a higher chance. But I would say with your fertilization, like you have really good fertilization rate. So if you had seven retrieved, and seven frozen, we probably say maybe three to two to three may not be normal, out of the batch that you have. So it's more than likely you have one or two abnormal embryos. But also, that still doesn't mean that you can't have a healthy baby, because we are now finding studies that, you know, people are transferring mosaic embryos and their babies are perfectly healthy, that they somehow correct themselves in utero.
and I do have my six that are frozen, but we are also open to trying again naturally.
Yeah. I would say with the right team that you have, I think that, yeah, it's definitely possible for you to try again. Because I mean, as long as you are, you're open and stuff like that, I don't see. I would as a, I wouldn't see a reason of why you couldn't, do it again naturally either. But you always got your backups. You got your squad in there.
And just with the honestly, like I've always heard, like, oh, this is the best insurance for IVF. If you want to talk about some numbers, all I had to pay was my out of pocket cost for my medication, and I paid 150 per med. So my total out of pocket cost for IVF was $450.
But you can't beat. I always recommend, we recommend finding employment to pay for it, even if you work there just temporarily. Starbucks. There's a girl here on TikTok. She has her Starbucks baby. She got her embryos, and she worked part time at Starbucks. So, and there's other companies that offer IVF benefits. If you can find a place that covers it, definitely do that because it's just so expensive. And see, you're not talking, see, you don't know numbers. So you talk about donor eggs and you talk about third party reproduction, honey. Because, yeah, we talk about $30,000 out of pocket sometimes, 30 to $50,000 because you got to get that embryo, that egg donor. You got to pay for her, and then you have to pay for her cycle on top of your own cycle. So numbers, and so I got insurance.
I will say this. And my husband and I had this discussion about if we do decide, like, okay, we'll try naturally, what to do with our embryos. And I was a big advocate for potentially donating them simply
Mm-hmm.
because a lot of Black women do not do IVF and they don't have the resources, they don't have the knowledge, they don't have the family support. And I was truly shocked. My sister, I seen her in the comments, she joined the live too, but I seen that I was very shocked at the amount of support I had from my family during my cycle. Like they'd call me every day, we'd FaceTime, they'd watch me take my shots. They were so excited for my embryo transfer and just that it was successful. But even still going through this process, there was still no guarantee for me, especially with the antiphospholipid syndrome. And now I'm actually 32 weeks today. So
I know. So we get there to the transfer. How was your transfer day? Everybody's transfer day is different. How was your transfer day?
So I felt bad. So I had my polyp removed 4th of July weekend, and that was my first time ever having surgery. So I was very nervous about it, but it went so well. And everyone said, like, oh, the polyp removal is similar to how your egg retrieval will be. That's a lie. That egg retrieval, I felt like I literally came back from the OR and I'm like, I felt like y'all stabbed me with a knife. Like, I feel it. Somebody is lying. That nurse stole my drugs or something because I feel this.
Right, right, right.
And it was my husband's birthday. So I felt bad. Like I was definitely out of commission, but I still made him dinner. And so my embryo transfer was actually on my birthday. So it happened at noon. We woke up, we had breakfast, and I just remember them like an hour before your appointment, chug some water. So I'm like waiting. I'm like, oh my God, I gotta hurry up and get back here. Let's transfer this embryo because my bladder's full. And my nurse is like, please go pee because you're gonna like ruin it. So
So being on my fourth one, I've now got that down. When they tell me to do the 32 ounces, no, honey, I do 16 because I know they're gonna be running behind, and then I'm gonna be sitting there because they say the same thing to me too. It's like, well, you can go use the bathroom, and I'm like, it's all or nothing, okay? It's no just listen. You either gonna have to do this, or we gonna have to wait another 2 hours for me to fill up again. Because what they gonna do is they gonna run behind, honey. They gonna run behind every single time.
they did so good. Like it was like we walked in at like 12 and we were out by like 1 o'clock. We went to Rita's. But I just remember for my embryo transfer, she's like, please go pee. And then she's giving me water. So she's like taking pictures of me and my husband. I got a cup of water in my hand because I'm trying to chug it. And just my team, my ultrasound tech, her name was Nikki. Nikki at all my 5 a.m. appointments, she did my ultrasound. So I was so happy that she was there to help with my embryo transfer. We listened to Cowboy Carter. And so that album's very special to me. But the whole time they're doing this transfer in my mind, I'm like, please don't pee on them. Please don't pee on them.
It's
And
okay. We've all done it. It's okay. It's okay, honey. We've all done it. They used to it at this point.
reproductive endocrinologist, I love her. Like she, we talked, we laughed, we joked the whole time. And so some things that I do remember besides like me trying not to pee on them was once they check the syringe and make sure that the embryo went through, the embryologist came back and said, the embryo's in you, it's yours, take care of it. And I just like, I sobbed. And like my husband's there and we're kissing and we're sobbing. And then like everyone in the room is sobbing because they know me, they've worked with me, and they were like, this is why we do what we do. And it was a sigh of relief, but it was also some anxiety because, again, just because I did this did not guarantee. And they told me, they're like, from today on, you're pregnant. So act like you're pregnant, be pregnant. And I remember doing my first beta 10 days later. Like I did test it out. And so once I got my first positive after I tested out my trigger shot, I was like, okay, I'm not going to test anymore. I went to my fertility clinic, got my labs drawn, drove to the other side of town because I had to be at another campus for work. And normally I get my labs back in an hour. It took 4 hours to come back. So in my mind, I'm like, these labs are terrible. They're trying to like there's again, I've had nothing but bad news. So in my
Right.
mind, I'm like, oh my God, they're trying to like find a way to tell me that this was unsuccessful. And so I just looked at my chart and my first beta was like almost 400. And I was like, oh my God, I've never been this pregnant before.
Right.
So it was a huge sigh of relief. And they told me, and they're like, hey, you're going to come get your confirmation this day. Make sure you find another OB. And they found one for me because they know I didn't like anybody. So, and even like the day of confirmation, like I just remember hearing my baby's heartbeat for the first time. Like we've never made it to that point.
Right.
So
And
it
how did
was,
that feel?
oh, still terrified just because, especially like having APS. I said, okay, once I make it a second trimester, I'll feel better. Made it a second trimester, and it's like, oh no, I still have anxiety. Let me just make it to viability. So 24 weeks, I'm like, okay, I'll feel better. And now, like, I'm at 32 weeks. It's like I'm not gonna feel comfortable until I see and hold my baby. But I'm thankful to have made it this far. I'm thankful to be this pregnant. I'm thankful for IVF.
And I think that there's some women in the chat who also feel the same way, that when you've gone through so much and you've gone through losses and you've gone through, everything that you went through. And my sister-in-law, she had she's on her fourth. She just had hers. And I remember Christmas time her talking about it, and I said to her, I said, um, and you're probably still anxious. She said, I won't be the same way. And let me just tell you, as a bonus mom, your anxiety is gonna be there forever, okay? Because when it comes out, now you're gonna be like, is he still breathing? Are they still breathing? Like, just be prepared to just be anxious for the rest of the rest of the time, because just being a mom, being a mother, just in general, you're gonna have some certain anxieties, but hopefully it will all diminish, and it'll just be another set of anxieties once that baby gets here. But um, I think everyone can say, Shannon's in here. She had a terrible pregnancy, so um, she, definitely knows how you feel. Keisha, I think I saw her in here. Juanetta, she's in here. They all know exactly. These are all IVF girlies who all know that anxiety of what you feel of, like you said, my baby not moving. We need to go. We ride at dawn to find out why my baby not moving. You know. Because we need answers today about what's going on. So everything that you're feeling is definitely totally normal, um, especially when you've been through what you've been through. Um, I would be concerned if you didn't feel like, anxious, about the things that you're feeling right now. Do we? So I'm assuming we're gonna wait and see, because you did a first transfer. We're just waiting to see what it is when it come out.
So I I did not want to know baby's gender.
Okay.
I feel like you have very few opportunities in life to be surprised. However,
Yes.
I will say this. This is the first time I've ever said this. This is actually the first time I've ever talked about like my fertility journey. So
Oh wow.
I have I have never, ever, 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 like outside of like family and close friends, no one knows that I've been pregnant before. No one knows I've had a miscarriage. No one knows I did IVF. So I've been very tight-lipped about it. But most studies show that most IVF babies are boys. Most embryos that I transferred are boys. And so the minute I got pregnant, I'm like, it's a boy. and no one in my family has boys. I have 1,000 nieces, and I'm like, no, I'm having a boy, I'm having a boy, and they're like, no, it's a girl, it's a girl. So baby Avery is a boy.
You know for sure.
Baby Avery, he's the most stubborn baby. He will show you. I mean, of course, being an IVF mom, they want to look at his heart and look at everything.
Right.
He doesn't show you that, but he will show you that pee pee. He will.
He says, "Hello." Shannon, Shannon has a boy too, and listen, baby boy was loud and proud, okay? Just all the time. Crazy for sure.
Oh, he like we're trying to measure. Oh, he's got his hands up like this, got his legs over his head, looking at his spine. He want to flip over. You want to see his face? He's gonna go like this. But you want to see gender?
When that is in the chat, she said, "That's my boy too." Sir, we can see you, okay?
Yes, baby Avery is a boy. I have not shared that just yet. I was gonna wait till my baby shower is actually next Saturday, so I was gonna wait to share it with everyone next Saturday. But it's a boy.
uh, and how do you feel like, because I mean, we only got like, are they making you go early or are they gonna let you go to term?
They told me pre-pregnancy that they'd let me go to 34 weeks at least.
Okay.
Um, I've done very well with pregnancy. Like my previous pregnancies, I had a lot of issues. I was very sick. But I've done very well. So they're like, oh, we'll let you go to 37. Then it's like, oh, we'll go to 38. And they're like, well, let's do 39. And I'm like, well, we might as well just go to term at this point.
At this point.
So I have, even if you don't have APS, if you're an IVF mom, you do twice weekly NST testing. So I have to
Right.
do it. And then I get a growth scan on Friday because having APS, you're at risk for uterine growth restriction, and
Right.
with me because I did lose weight, but I'm still thick. I take my Lovenox twice a day.
Okay. Okay.
So they really want to make sure with the Lovenox more than anything. And I also another woman that I work with, she has APS and she had a stillborn later
Okay.
in pregnancy.
So
So
they're watching you really closely.
yes, I'm at the doctor at least every other day.
I mean, listen, this is a lot of money. So even if it's $500, we don't spend a lot of money and a lot of heartache. So we just do what we need to do, honey. We just listen. Okay, y'all see me every day. He probably
I
sick of you. I'm just gonna let you know he gonna be sick of you. He gonna be sick of all y'all because y'all done had him on that camera and everything. He ain't gonna want to talk to y'all for about at least 5 to 7 business days.
well, I had begged because I I cover 10 different facilities for my job. So I travel a lot for work and being in school and trying to do it all. I'm like, I'm so busy. I don't have time to go to the doctor like this. I promise y'all, I'll call. They asked me the same thing. Any bleeding? Any clotting? Any spotting? Do you feel that's check for heartbeat? We good. We are so good.
Right,
But I begged for like a little break just to get myself together, and that was
right.
the one day I didn't feel baby move. I'm like, I skipped one appointment day, and you want to cut up, and I didn't feel him move for at least 12 hours. Like, I mean, he does have quiet days, so I'm like, oh, he's just sleeping. But then after a while, like I drank my favorite drink. We did our little morning routine, and he didn't wake up. So I'm like, I told him before I got ready, I said, if you don't move, I'm going to take you to see these people, and I know you don't like them. He still didn't move. The minute I sat in that lobby is when he started to move. And when they hooked me up to that monitor, he took his whole foot and kicked it off.
You said it's too late. We here now. We already here. We just sitting in the. It's too late now because I told you. I said what I said. So,
I said, if you don't move, I'm gonna take you to see that he is. And I like his last ultrasound. I don't even post pictures of his little face no more because his last one, he was like, I was like, oh, this is my baby. I was like, oh, this is my child. This is 100%. He does not. Lady's trying to do my growth scan. He's like this to the probe. He does not like to be seen at all.
Already got a little personality. Already got a little personality already. This is amazing. So I will say to you, because we ain't got to the end yet. We still waiting. Um so I asked my last two questions. Is um because we often talk about bonds. My baby, it will be the same thing. I'll be pregnant. It just won't be genetically related to me. But you haven't met him yet. How is your bond with your baby?
My favorite part of my day is at 2 o'clock in the morning when he headbutts my bladder. After I pee, I lay down and I touch him, and it's like he moves to my hand, and it's like it's our time. And there's some days like I was in meetings today, so I didn't really talk a lot. And then I'm just us having this conversation. He hears my voice and he goes crazy. And it's like that's a way to get him to move. So it's scary. Um, even though your baby will not genetically be yours, but when you carry them, or even if you adopt them, however you pursue your motherhood, you love them so much because you wanted them so bad. And I think it's crazy that I love someone that I've never seen, never heard, but I feel them. It's like scary almost. And I know it's only going to get worse, like, when I finally, like when we lock eyes,
Right.
but there's nothing, everything I went through was worth it for him.
And I think Juanetta, she's currently pregnant. She has a donor. And um, Kati, she did an interview with me. She's currently pregnant too, as well. So I think they can definitely understand how you feel right now that they're both currently pregnant. Kati has her own, but Juanetta has a donor, and they both know exactly how you feel carrying a pregnancy. Um, and I think that anybody's carrying like that. I think that feeling is just undescribable. No matter how the baby got into you, that um, they said sending so much love to you on this journey, but there's undescribable being bonding. Well, you gonna cry anyway, girl. Are you pregnant?
Honestly, like I always say I'm like I'm a thug. Thugs don't cry. But like I watched the promo this morning when I was getting ready for work, and I was sobbing. I'm like, I know